Hi everyone, my name is Laurel Meier, and today I'm going to show you how to draw up and give your Delestrogen. This medication is made by different manufacturers, and you can see by this slide that the vial can look differently depending on who makes it. It does come in 3 strengths, 10, 20, and 40 milligrams per ml. And the reason why I mention this is it's really important to check your vial and see what strength you have, and then let your clinic know what strength it is, and they can tell you how much to take. As an example, a typical dose is 4.8 milligrams twice a week intramuscularly. So if your strength is 10 milligrams per ml, you would give 0.48 milliliters. As the dosage or as the medication gets stronger, you give less. So with 20 milligrams, it'd be 0.24, and with 40 milligrams, it would be 0.12. And I'll show you how to find that on the syringe. So the main thing is just to make sure you check with your clinic, tell them what strength you have, and they'll tell you what dose to take and how often. Now, Delestrogen is used to thicken the lining. It's typically used in a frozen embryo transfer cycle, and it thickens the lining so that it becomes a nice home for the embryo. We're going to talk about now where to give that shot, and there's 2 IM injection sites. There's one called the dorsogluteal muscle. This is the upper outer quadrant of the buttocks. If you put an X on your buttock cheek, it is the upper outer section. This site, you do need to aspirate, and we'll talk about what that is in a few minutes. The other site, the ventrogluteal muscle, is on the side of the body. And to find this site, I want everyone watching to find your hip bone, slide your fingers about 2 inches below the hip bone, right on the side of your body. And this is the ventrogluteal muscle. Slide your fingers 2 to 3 inches straight back from that site. This is the dorsogluteal muscle. Now, if your partner is finding the site for you, they can do as the picture is showing, find your hip bone, put their fingers under the hip bone, and spread the pointer and middle fingers apart to form a V, and this is the site. So this is the ideal site for several reasons. The ventrogluteal muscle is much bigger than the dorsoglute. It does not have any nerves or vessels that are large enough to puncture or to damage in any way. So this is considered the perfect site for an IM shot. It also can handle that shot that's given repeatedly for over several weeks, like the Delestrogen is. So the next thing we're going to do is to draw up the medication. We are going to gather our supplies. You're going to need your medication, your 2 needles, one for drawing up and one for giving. And you'll want to look at them, and you'll want to see there's one that's thicker that you're going to draw up with, and one that's thinner that you're going to want to give it with. There's your 1 milliliter syringe, and your alcohol wipe, and a Kleenex. Okay, you want to have all these supplies ready. You want to wash your hands first, of course. First thing you'll do is take your cap off, alcohol the top of your medication. You want to do this every time. And then you get out your syringe and your 2 needles. You'll put the skinny one just on the table, and you'll get your thicker one and you'll put it on the syringe. So twist it on like that, and you're ready to draw up. Now, I'm going to use 0.24 as an example because this is typical. 0.24 is, if you look at your syringe, you find the 0.2 line, and you count 4 little lines past it, and you put that amount of air in if that is your dose. So whatever your dose is, that's the amount of air you're going to put in your syringe. Take off your cap. Put the needle in the circle in the very middle and turn everything upside down. You're going to pull back a little, making sure that the tip of the needle is in the oil. Push your air in, and then draw back, and it will start to drip slowly down the side. And this is one of those times that you have to be patient because it will drip pretty darn slow. And as you can see, it's just drip, 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 sliding down the side. And you want a little more than your dose, and then you can push the air out. And you want the black line to end up right at your dose. So I'm going to go to the 0.2 plus 4 little lines, like that. Now you turn everything back up, right side up, pull your needle out, and then with a one-handed technique, you want to recap. The best way to do that is just to put the cap on the counter and slide the needle in like that and click it on. Now you switch to the give needle. And now you're ready to give the shot. So a couple helpful hints on how to make this shot less painful. You can choose to purchase a numbing cream or a numbing patch. Sonera is a numbing patch you can use. And if you use either of these, you won't feel the poke at all. You can choose to ice the site for about 60 seconds beforehand. That can help. And another nifty technique is the tickle technique. That's what I call it. So what this is tickling the skin next to where you're going to give the shot on either side as you're going in with the needle. And this takes advantage of what's called the gate nerve theory. And it will actually trick the skin into not feeling the poke. And it works very, very well. So what you're going to do is pick your site, and you want the muscle to be completely relaxed. So in order to do this, I would recommend just lying on your side on a bed with your partner next to you that's going to give you your shot. Or if you prefer to stand, you can stand with all of your weight on the opposite leg from the side you're going to receive the shot. So I would have a counter handy just for balance and put your toe on the ground for stability. And your partner can sit in a chair next to you. Or if you have to give the shot yourself, I recommend the same standing technique. Put all your weight on the opposite side from the side you're going to give it. And I would give it on the dominant side with your dominant hand. So if you're right-handed, it'd be the right hip. So with that in mind, now to give the shot, the tickle technique, tickle, 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 and you're going to go straight in like a dart at a 90-degree angle. If you use the dorsal gluteal or the upper outer quadrant of the buttocks site, then you'll need to aspirate. And what that is pulling back on the plunger and looking for blood return. The reason you do this, although it is very rare, sometimes the tip of the needle can go directly into a vessel. And if the tip is in the vessel, you're going to pull back and see blood that comes into the syringe. If that happens, you're going to want to pull this out, switch the needle to a new needle, and go to a new site and give the shot. And it's okay to give the blood, the medication with the blood mixed in back to you because it's your blood and it won't hurt you. But if you use the ventral gluteal site, you can skip that step. So you go in, you just go ahead and give the medication. Once it's all the way in, wait about 3 seconds, pull out, and have a Kleenex handy to hold the site firmly. You want to keep your muscle relaxed this whole time. And then after about a minute, your partner's going to check the site. If there's any blood or medicine leaking out, you'll continue to hold the site until it's dry. Check it again, it's dry, you're all done. Everything will go in the sharps container. And then this will go back in the cupboard. You don't want to put this in the refrigerator, and that's all there is to it.